This is Heidi Gullett. I'm a family and public health physician, and I see patients at Neighborhood Family Practice here in Cleveland. I will be discussing what is population health. We often teach you about the individual that you'll see and spend most of your careers treating. It's important to understand that the World Health Organization definition of health is a state of complete physical, mental, and social well-being, not merely the absence of disease or infirmity. So the basic definition of population health is the health outcomes of a group of individuals, including distribution of such outcomes within a certain group. It's important to understand both what is the denominator of that group and what is the numerator. Because as you will come to understand, you need to know epidemiology and biostatistics in order to interpret anything about populations, whether you're applying evidence-based medicine to an individual or you're looking at how to improve the health of a particular community. There are also multiple determinants of health for populations, and you cannot understand population health without recognizing that it's intimately linked to the multiple determinants of health, some of which we often rename the social determinants of health. As you can see in this mental model, there are numerous determinants of health at multiple levels in any community, starting with the individual and going out to the general socioeconomic, cultural, and environmental conditions in which those individuals live. We are interested in the incidence of HIV infections in a particular community over a 1-year time span. So it's important to understand what is the population health in this community with regard to HIV. So what would be an HIV incidence outcome that you're looking at with regard to population health here? Just remember that population health outcomes are products of multiple determinants of health, and HIV is a very clear example where you have multiple determinants of health impacting the incidence of HIV in both individuals and then in the community at large. So if you consider the population in a particular community, let's say the community most impacted in Indiana, currently with the HIV outbreak, you'll see that the denominator, remember we need the denominator defining the entire population, would be U.S. Census Bureau data for that particular community. So you know what is the totality of the number of individuals in that defined population. And in this case, we're going to pick a geographical unit, such as a county, because it's easy to know that we have correct data. Then you'll need something known as the numerator, right? So you need to know what proportion of the individuals within that population have been diagnosed with HIV in the last year. So that's indeed a separate data source, most often a source of public health surveillance data when we're talking about infectious disease. So the laboratory and the physician would both report to the local county health department about the new incidence of HIV in a particular individual. The county health department would then use the surveillance system that's set up in that location to show you in aggregate how many HIV infections there are in this particular population. So you're looking in this case at a particular population, the incidence of HIV. Therefore, you have a numerator, HIV infections in 1 year. You have a denominator, U.S. Census Bureau data on the number of people living in that particular population.